It started as a simple sinus headache, but what doctors found hidden inside this patient's nasal cavity left the entire medical team in shock. For months, the patient
intricate
complained
structures
of a
of the nasal
persistent
passage,
blockage
including
that
the
simply wouldn't
septum
go
and the
away
superior-
despite numerous treatments. Over-the-counter sprays and allergy medications provided zero relief for the growing pressure and constant throbbing pain. The nasal cavity is a complex network, easily obstructed by inflammation, polyps, or rare foreign objects hidden from view. Finally, seeking answers, they visited a specialist at the renowned Medicare Tube USA Medical Center for a thorough examination. The physician prepared for a routine endoscopy, a crucial step to locate the true source of the patient's long-term distress. As the camera moved deeper, a strange calcified mass slowly began to emerge from the dark, hidden corners of the nose. It wasn't a common polyp, nor a typical infection. This was something far more unusual and deeply embedded in the cavity. Medically known as a rhinolith, these nasal stones can grow silently over many years, often remaining completely unnoticed for decades. The decision was made immediately. This object had to be removed before it caused permanent damage or a severe bone infection. The patient was informed of the findings, a rare calcified obstruction that required a careful and immediate surgical intervention. Understanding the exact location was critical to avoid damaging the sensitive nerves and blood vessels nearby during the process. Preparation was meticulous, as the stone's jagged edges made it a high-risk extraction that required specialized medical tools. The patient was prepped with a local anesthetic to ensure they felt no pain while the surgical team worked on the area. With everything ready, the specialist began the delicate task of reclaiming the patient's airway and removing the mysterious mass. The extraction began. The surgeon used a micro-hook to gently test how firmly the stone was embedded in the tissue. Precision is everything in these cases. Even a millimeter of deviation could cause a significant and dangerous nasal bleed. As the stone shifted slightly, it revealed years of trapped debris and inflammation behind the hard, calcified wall. This wasn't just a simple blockage, it was a biological buildup that had become as hard as a solid rock over time. Constant suction was used to keep the view clear and remove any loose mineral fragments during the delicate procedure. A stronger grip was needed. The surgeon carefully locked the specialized forceps onto the stone's core for better leverage. The atmosphere in the room was tense as the team worked through the narrowest part of the internal nasal passage. The stone was too wide to pull straight out, so it had to be rotated with extreme care to avoid any tearing. Gentle saline irrigation helped lubricate the passage, easing the stone forward bit by bit without causing any trauma. Patience is the surgeon's best tool. This process cannot be rushed without risking injury to the patient's delicate anatomy. Finally, the widest part of the mass cleared the narrowest part of the internal bone, moving closer to the exit. Every second required 100% concentration to ensure the patient remained safe and comfortable throughout the surgery. The surgical team moved into the final stage of the extraction, slowly approaching the visible nasal opening. The sheer size of the object was becoming apparent as it reached the surface, surprising everyone in the operating room. The final tug was prepared. A sterile gauze was positioned and ready to catch the mysterious and long-hidden culprit. The bond was finally broken. The stone was now completely free from the internal nasal lining and the surrounding tissue. A sense of relief filled the room as the object finally began its exit after years of causing silent suffering. Watch closely. This is the moment years of chronic pain and pressure are finally removed from the patient's body. Because of its weight and jagged size, the doctor had to support the stone carefully to avoid any external skin tears. And there it is, a massive rhinolith, extracted perfectly after a long and careful battle by the medical specialists. The object was a jagged, calcified mass that looked more like a piece of granite than something found in a body. Measuring over 2 centimeters, it's a miracle the patient could breathe at all through such a significant obstruction. It was as hard as a rock, a result of decades of mineral accumulation around a tiny, forgotten nucleus or seed. The patient's first breath after the procedure was a pure, unblocked release, a feeling they hadn't known in years. The air can now flow freely, ending the chronic headaches and pressure that had plagued their daily life for so long. The patient could hardly believe that such a large and heavy object had been hidden deep inside their nose. If you ever experience a persistent blockage on just one side, don't wait. See a medical specialist immediately for help. A simple 30-minute procedure changed this patient's life forever. It is a powerful reminder that health is truly wealth. At Medicare Tube USA, we bring you the most incredible and educational stories from the fascinating world of modern medicine. Don't forget to like and subscribe for more fascinating medical cases. We'll see you in the next educational video.